It has been 25 years since the West recognized not only the existence but the validity of Chinese or Oriental medicine. Not only recognizing the practice and the benefits of, but also the beginnings, the basic principle of Chinese medicine, which is the flow of qi throughout the human body. This qi being universal energy which flows throughout the universe and also through our bodies. The concept of meridians, the flow channels for this qi, the pressure points, the acupuncture points, all having to do with this qi flow throughout the body. 25 years ago is not a long time. They recognized acupuncture at that time in the mid-70s for its worth as an anesthesia. Since then, they have embraced each day, each week, each month, and each year something new that is basically imported to us from the Orient. We recognize now that the acupuncture and some of the other modalities of Oriental medicine is very beneficial in diminishing pain, in helping cure illnesses, diseases, amongst a multitude of concerns. Recently, compared to 25 years, we have a major concern here in this country as well as the rest of the world with women's issues, pregnancies, genital problems, infertility, and others. The show today deals with that. The show today deals with just such Oriental methods to combine strengths against some of the problems that we see. Western medicine has done an excellent job for a long time, and now embracing Oriental medicine, we can now skirmish into other methods to help those people in need. I'm here, once again, at the Somerset County Chiropractic and Acupuncture Center here in Somerville, New Jersey. And of course, who will be on the show will be Dr. James Golding, who is a chiropractor, acupuncturist, and very knowledgeable in Chinese herbal medicine. The show has some people with us. We will demonstrate some of these techniques and certainly talk about and explain and discuss what benefits from acupuncture and some of the other modalities. Sitting next to me is Regina Skorga, who is a client of Dr. Golding here at the center, and she has volunteered to help us tonight with this show, acting as a patient, which you are, okay?
Yes.
And first I want to welcome you to Asian Culture in America.
Thank you very
and
much.
Helping us out, okay? And you know, the topic, of course, is sort of women's issues and Chinese medicine, right? And as a woman, okay, how do you feel about this all of a sudden, this reaching out into China and into the Orient for medicines that pertain to women's issues?
I think it's very exciting. For years and years, it was just the approach, the angle of the Western medicine, and now to have a whole new aspect brought into it, it's exciting. It brings with it dimensions and new ways of thinking about it, and for myself, it's been very beneficial.
You've had acupuncture, and I'm not sure the other methods here. Can you tell us what pertaining to what?
Well, initially I came to Dr. Golding for ankle pain, and I received acupuncture for that. After several sessions, I discovered that my menstrual cramping, which I had for years been treated by Western medicine, was completely alleviated. I was very pleased. It was an added bonus that I never expected and welcomed.
So you were involved with women's issues here this time?
Correct.
Everything's fine? Went well?
Moving right along.
Wow, that's great. Okay, well, I'm looking forward to seeing you being worked on. All right, and I'm sure you feel the same way. Huh?
Thank
it's
you.
always a pleasure, isn't it?
Thank you.
Okay, I'm going to bring on Dr. Golding now so we can talk about this great topic that he's chosen for tonight's show. Well, Dr. Golding, it is always a pleasure to have you on my show. You have done so much for the value of some of the shows for Asian culture in America that I really look forward to every time you mention you have another topic.
Thank you very much, Master Sher.
Today's topic, as we brought out, is Chinese medicine and a lot of women's issues in medicine. What are we going to see on this show?
Because there is such an interest in Chinese medicine in the treatment of these particular afflictions, we have chosen a few things tonight to talk about in women's health issues that treat very well. Number one, we're going to be talking about premenstrual tension or premenstrual syndrome with the inclusion of breast distension. We're going to talk about morning sickness and the treatment, at which we're going to demonstrate the treatment for morning sickness. We're going to talk about fetal malposition and how traditional Chinese medicine is used to help to correct that. We are going to talk about menstrual irregularities, including dysmenorrhea, which is painful menstruation. And we're also going to have a special section at the end of this evening on women's infertility and the treatment of infertility utilizing Chinese medicine. And with us tonight will be Lisa Rippey, who specializes in these issues. She has a clinic out in Long Island.
Is this going to be primarily acupuncture or other modalities?
Well, it's going to. The demonstration is going to be acupuncture and traditional Chinese medicine using moxibustion. But keep in mind that all of the conditions that we're going to be talking about tonight are best treated when used in conjunction with Chinese herbal medicine, and that accelerates the rate of improvement, with the exception of morning sickness. We won't be giving any herbs for that, or fetal repositioning. But everything else is best treated when used with Chinese herbal medicine.
This in conjunction with these type of treatments with Western so-called traditional medicine, or does this stand on its own?
All of the conditions that we're going to talk about and treat tonight. Now, none of this is to take the place of Western medicine or a good gynecological examination, a good physical exam, blood work. All of the Western means that should normally be used should also be incorporated in with what we're doing. What we're advocating, though, is that traditional Chinese medicine is an alternative or adjunct to Western medicine in the treatment of some of these health conditions that Western medicine doesn't treat all that well.
You know, Dr. Golding, the topic for tonight, women's issues primarily, okay, in Chinese medicine, okay, or the helping of, is, I think, my knowledge, is very unusual. I mean, it isn't something that you think in terms of acupuncture and women's issues. Is this recent?
It's very interesting that you should mention this. And the reason why I say that is that when I was going to Chinese school for Chinese medicine, in that college, they spent an inordinate amount, what I considered to be an inordinate amount of time on gynecological issues and women's health issues. And when going through all of the training at this time, in the back of my mind, I was saying, I don't really think that women are going to be coming to me for treatment for these problems. It's not really why I went to acupuncture school. And I was surprised, now being in practice, over the course of the years, that women's issues, they are taking a larger and larger portion of my practice because it treats so well utilizing Chinese medicine, and there's more of an openness about it. So where I thought it was totally wrong in that direction, it really is turned out that the training that was offered up was appropriate for what was going on.
Well, I think that's very beneficial to the female community, not only here but in the world.
Right.
You know, Europe and those things that are not used to acupuncture for thousands of years.
I'm hoping that the demonstration that we're going to show today will also make women feel more comfortable about addressing these issues with Chinese medicine, keeping in mind that acupuncturists are not gynecologists, and we do not do internal examinations, and we do not do examinations in areas that are considered to be sensitive, nor is our treatment in general around in these areas. So most of the treatment rendered for these conditions are distal or further away from you know, their sensitive portions of their bodies, if we're dealing within the breast area or you know, vaginal area, that type of thing.
I think what's helped on the Western point of view is in not so recent years, but in recent years compared to how long the West has been here, is the openness of women's medical issues. It was almost like a taboo in the sense that you didn't talk much about it. You didn't see ads on television and on radio and in magazines like you do now. There's an openness of it's nothing. You know.
Very much so. Even when I speak to many women today, they relate to me the fact that there was a very disjointed thing in, like, when they first had the onset of their period. Like their mother never really discussed with them, and they learned a lot of their own anatomy and physiology from their girlfriends or on the street. Whereas I think that's changed considerably now. In less than a generation, we're seeing it from being this thing that was referred to as, you know, that time of the month, or some type of secret, or that type of thing, to something that can be openly discussed as, you know, just a way of life. You know, that's a portion of life.
Well, going parallel to it also is this recognition of women's medical issues, men also. I see that as becoming more open,
right?
Talking about,
impotence and things like of that sort. I think sexual dysfunction, things of this nature are coming to the forefront, and we're not. I think it's an expression just like it used to be when someone had a psychological or mental disorder, or you know, this whole thing of having to go for counseling. You know, men and women were resistant to this. They don't want to recognize that they had failings or shortcomings in that category.
Okay, so we're going to go into the other room now, to the treatment room, and we're going to see Regina, who was just on. Right?
Happy to do so, Master Sher.
Well, let's join it and get in there. Well, Dr. Golding, what are we going to do now? What are you going to be working on?
The first thing that we're going to demonstrate today on Regina is that we're going to demonstrate a treatment for fetal malposition. Fetal malposition is an abnormal positioning of the baby at or before 30 weeks of pregnancy. The Chinese have done studies that this technique utilizing moxibustion has an 80% success rate in treatment of either transverse or breech positions. Now, transverse or breech positions are determined by an internal examination by the obstetrician, but the actual treatment itself is rendered by the acupuncturist. Western studies have also shown a high degree of efficacy utilizing moxibustion, but Western studies are done during certain segments of time. What I'd like you to do is to show you right now what's done for the treatment of fetal malposition. Thread moxibustion is applied to what's known as bladder 67. Bladder 67 is this point at the terminal end of the fifth toe. What I'm utilizing is incense that will ignite the thread moxa. This thread moxa will burn down and apply heat directly into the end of the fifth toe. This is known as thread moxibustion. We will do this for a series of 20 times on each foot, and this will be applied preferably at least once a day, usually twice a day. What I do is that since it's not practical for my patients to come into the office twice a day, what I provide them with is I provide them with what's known as moxa essence. This is a liquefied form of moxibustion, which they can do for the second time applied at home. This is sprayed on to the involved area in question, and then what they will utilize at home is a hair dryer, and they will apply the hair dryer to this point and dry the moxa on this. What we utilize for this technique in the office is known as a bioptron, and a bioptron is a polarized light heat source that works better when utilizing liquid moxibustion. What I'm now demonstrating is an acupuncture technique that's utilized in the treatment of morning sickness. Morning sickness is a very commonly associated problem with early stages of pregnancy. It is not to be taken lightly. Some women experience it only mildly. Some women experience extreme health consequences associated with it, anywhere from nausea to vomiting to diarrhea to generalized fatigue and body weakness. This leads and lends itself towards sometimes serious health complications for the mother and developing child. The National Health Institute has recently done an exhaustive study that demonstrates that treatment utilizing acupuncture for morning sickness and that associated with treatment for chemotherapy-associated symptoms are one of the most efficacious uses of acupuncture. What we've done is that to expedite our treatment and demonstration tonight, just to let you know, we have needled 10 acupuncture points in the body, and what I'm going to do is just show you the last point. It's known as pericardium 6 that we needle, and that is a point that is 2 thumb points up from the wrist crease. It's used for nausea. The woman will come into the office. She needs to be in the office for about a half an hour to 45 minutes. She'll be under the needles for that time. Usually the patient will experience a change or results to treatment in anywhere from 2 to 4 treatments. It's a very quickly oriented thing. It's not prolonged treatment, and it reacts very, very quickly. PMS, or premenstrual syndrome, is one of the most common reoccurring maladies suffered by women. It is very effectively treated by utilizing acupuncture and traditional Chinese herbology. It frequently happens in a period of time anywhere from 1 to 3 hormonal cycles is involved in the regulation utilizing this care. Treatment is painless. It's extremely effective. We go through a criteria that involves taking a very intense patient history. We do a tongue and pulse diagnosis, and one of the most common Chinese diagnoses for premenstrual syndrome is known as constrained liver qi. It is predominant in our hectic lifestyle that we lead nowadays, and all of the symptoms associated with this are part of that diagnosis, along with frustration, anger, and irritability. The Chinese have associated not only the combination of symptoms experienced by people, but also the emotions that they experience, and have correlated that to dysfunction as far as a women's abnormalities. What happens is that the woman needs to allow for treatment is usually rendered at a frequency of twice for the first week, and then once a week for a 4-week period of time, and then usually either bi-monthly for a treatment or 2 until her hormonal cycle is regulated. This, along with adjunctive Chinese herbal medicine, is usually enough to correct the condition over the long term. What we're going to treat now, Master Sher, is that we're going to treat dysmenorrhea, which is painful menstruation. We are also going to treat irregular menstrual patterns. This is women that have that menstruate in not the normal 28-day cycle. Either they menstruate early, or they menstruate in an unpredictable fashion, or they menstruate in a late manner. We've spoken before about the utilization of tongue and pulse diagnosis, along with an adequate history and total medical history in the treatment of the condition. Something that's very important in dysmenorrhea is abdominal palpation. Abdominal palpation is utilizing pressures along reflex points that originate in this quadrant of the body known as the abdomen. These reflexes or points of tenderness will give us a diagnostic indication of where we need to stick the acupuncture needles that may be in this region of the abdomen along with distal points. What I'm feeling for along with tender areas is certain nodules. Within Chinese medicine, constricted blood areas will feel like very tight nodules. Constrictions that come and go, or areas or swellings that come and go, will be palpably movable and non-tender to the touch. And these give us diagnostic criteria that we use in the treatment of painful menstrual syndromes. The numbers of treatments for painful menstruation is very similar to that in the treatment of PMS. In regards to the treatment of menstrual irregularity, that often takes more parameters into play and may require more Chinese herbal medicine and adjustments of that Chinese herbal medicine over a longer period of time, along with the acupuncture, to get the desired result. What we're going to do now is that I'm now going to introduce Lisa Rippey to the show tonight. She's going to utilize the rest of our show in the treatment of the very important issue of female infertility.
Well, I'm here with Lisa Rippey, who is a diplomat of acupuncture from New York City, and you're going to be working on Regina now for
infertility.
Infertility? Okay.
And infertility.
Now, I noticed you left some of the needles in from the last session. Is that okay?
I did, because a lot of the points that James used for the dysmenorrhea, the painful menstruation, are the same points that we're going to use to help deconstrain her liver qi, which is a tightening of the body, and that can happen from anything. It can happen from emotions. When women are infertile, they start to get worried about it, and sometimes it makes the problem even worse than it was to begin with. So what we're going to do is we're going to go in and we're actually going to needle the areas that we feel are constricted in her abdomen, because this is the primary example of constraint qi, a tight point in an area. There's no energy going to the conception vessel, the area where the baby is supposed to be.
So you can feel that with your fingers?
Yes, it can. And you go in and you feel these tight spots. Do you feel that? That's an area that we're going to open up so that the qi can flow freely and she can make a baby. So we're going to put in this point here, which is utilized for most gynecological problems. It's called Dysmenorrhea, gallbladder 26. We put one on each side. And we're going to go over to here to these spots that we feel the constrictions in. And we really want to feel those points. That's why you see me pushing those needles in and out, so that I can feel the qi arrive in the area. I can feel her constraint actually releasing.
Is this stomach meridian?
Yes, that's exactly stomach meridian. This here is conception vessel. We want to open that up so that she can conceive. Two more in the stomach. These points are for the ovary. And we want to make sure that you really get the point. No pun intended.
No, none taken. Just whizzed right over my head.
But what's happening here is that in a second, you're going to notice that surrounding these needles, and this one's starting already, that qi is arriving. It's getting red around the needle. And that means that blood is moving into the area. And when that happens, the constraint goes back out into circulation. And where does it go? We know it's going to be moving where it should be, because we have all the right distal points that we put in the feet and hands, and those points are to actually open up the conception vessel, to move the liver qi so that she can be free and flowing with her energy into her abdomen so she can get pregnant.
So you only make use of the one point on the conception vessel?
Just one point on the conception vessel. the conception vessel runs
Oh, you
straight
can
up
see
the
this
body.
one here on the stomach is so much redder than before as we sit here,
Yeah.
or stand here. Huh?
And the longer that we stand here, the more blood will collect around the needle, and that's a telltale sign that things are happening the right way for us.
Is this comfortable?
Yeah, it's fine. Did you feel much discomfort when I was...
Oh, no, but actually the point that you had mentioned that you felt a lot of constriction, that was tender. The actual insertion of the needle, that didn't bother me at all. It was the pressing on. I don't feel it at all now.
Okay, great. So she's comfortable. Now we're gonna
How long would you let this?
let her relax here for about 20 to 30 minutes and let the acupuncture do its work. And during that time, I usually tell the patient that they should go into sort of a meditation and with their mind, because you know how the mind is connected with the body. Use her mind to visualize her chi flowing up to her stomach and opening up anything that may be blocked. This way, the next time she's going to try to have a baby at home, she's not going to be all hyped up and worried about it, because now she's visualized that this area has been opened up.
Okay, do you have to do another treatment, or do you have to do another diagnosis, or can you tell now that this is working?
No, I would definitely do another treatment. I would probably treat her 1 to 2 times a week for 4 weeks, and then I would want to time it with her menstrual cycle, so that the week, she was going to be ovulating, that we want to get a treatment in a day or 2 before her ovulation, so that she's really with it. She knows she's ovulating. She knows that she's had this treatment. She's opened up her abdomen and her conception vessel for a month now, and now the day before her ovulation she's getting this treatment. So mentally and physically together she can make this happen.
Well, I guess we can thank her for going through all this, huh?
Sure can.
Yeah, now you do this
I
a lot
hope she
in your
wants to have a
practice?
baby after all
Yeah,
this.
I understand that you do this in your practice a lot. You have a lot of women's issues, huh?
A real...
So that's wonderful. That's really,
Mostly,
more than commendable.
It's true, but mostly, I get women that have already run the gamut of doing Western medicine. They take fertility drugs, and sometimes they've failed. They've tried frozen embryos. It's failed. Sometimes patients will come in and the doctors will say, well, it's just not happening. We have to give it up.
What would you tell the women out there?
I would tell them not to give up, because when all else fails, acupuncture works. And it could be a great surprise for someone to find out that they can get pregnant even though they've run the gamut of all drugs. They can come get acupuncture, open up their conception vessels, and they can get pregnant.
Well, thank you. I can't say it any better, and I certainly can't top what you're telling the women. And I hope the women that are watching this show will get something. I'm sure they will, about what they should maybe be doing.
Yeah.
Thanks again.
You're welcome.
And thank you.
Thanks.
Well, I hope the viewing audience, has learned something from this, particularly the females, and maybe going the right way or a different path, we can alleviate some of the pain and suffering and mishaps of pregnancies and other women's concerns. I want to thank you very much. How about you on this side, okay? Over here is Regina. Thanks for coming. Okay, enjoyed watching you.
Thank you, Regina.
I'd say thank you, Regina.
Thank you, Regina.
And of course, here are acupuncturists way over from Long Island. Okay, it's Lisa. Thank you.
You're welcome.
And
The slow boat from Long Island.
okay, you're always a pleasure.
Master Sher,
Thank you for helping my
Thank you
show
very much.
make some decent shows.
Appreciate it. Thank you.
And of course, I'm Paul Sher.
Good night.
Good night.
I can't do that, have I thought.